Have you ever felt nervous or worried before a presentation? This feeling is considered normal, but for 3% of the population, it doesn't go away. Maybe the stress doesn't come from a specific event and it always seems to be sort of there. This time it's considered to be anxiety. It causes things like chest pains, fatigue, and sleep disturbance. Sometimes it's also fear that people get anxious about doing everyday things like going to work or school. This anxiety might be a sign of generalized anxiety disorder, sometimes called GAD. GAD is defined as excessive, persistent, unreasonable worry about normal everyday things. For example, money, work, school, or relationships. Even the thought of getting through the day sometimes causes anxiety. People with GAD may not realize that their worry is persistent, excessive, or unreasonable, or they may not know how to control it. People with severe GAD may be completely out of it, or they may only be mildly affected and be able to function socially and hold down a job. Sometimes the feeling might get worse or get better over time. In addition to muscle tension and chest pains, it also causes edginess and restlessness, irritability, and difficulty concentrating. The psychological symptoms can lead to digestive problems and difficulty sleeping, which can have a serious effect on the body's well-being since it is not sleeping, which can lead to chronic fatigue. GAD has one specific quality to be diagnosed in the Diagnosis and Statistical Manual of the Mental Disorders, or the DSM-5. In order for a person to get diagnosed, they need to worry for more days than not over a period of 6 months. The second thing is, if a person finds it difficult to control their anxiety, meaning they have a hard time calming themselves down. In other words, maintain control of their feelings. Adults have 3 or more symptoms listed. Children however, have only 1 for them to be diagnosed with GAD. Another symptom that might cause impairment of your everyday life is missing the due dates for assignments, or finding it really hard to go to work or school because of the symptoms. The fifth and final diagnosis is the drugs are not because of a medical condition, such as hypothyroidism, which creates an excessive hormone which can produce anxiety symptoms. The cause of GAD is unclear. It has genetic and environmental factors. It is also shown to be twice as common in females than in males. Treatment may include psychotherapy. Cognitive behavioral therapy has proven to be the most effective because it teaches the person how to think and behave in different ways and react in different situations which would normally cause anxiety. Medications such as benzodiazepines or antidepressants might be prescribed as well. Benzodiazepines are a type of psychoactive drug that can have a more and calming effect. Antidepressants regulate serotonin levels in the brain and help elevate mood. Even though most medications have a similar effect, cognitive behavioral therapy has proven to be the most effective and most popular source of treatment. A case study about a 28-year-old Caucasian female comes to the clinic with complaints of joint pain and pains in her lower back. She cannot recall any time she's had an injury. She also says she has a hard time falling asleep at night and is unable to get a good night's sleep. Also, she often feels restless or on edge, which she associates with not sleeping. She states she consistently worries about her performance in school, her family, work, and her mother's health. The patient also exclaims she wakes up at night with painful headaches that last for a couple of hours. She also has difficulty paying attention in class and handing in her homework. The scores from the outcomes measure has signs and symptoms of a moderately severe form of GAD. The therapist explained to the patient that physical therapy cannot cure her GAD. However, therapists can treat the symptoms through education because there is no specific therapy. The therapist provided educational information pertaining to anxiety management techniques such as meditation, deep breathing, progressive muscle relaxation technique, exercise, and modifying her diet. The second case study is about Joe. He is a massive worrier and tends to worry about his everyday life. He worried about his health every time he had an ache or pain. He was sure he was going to die. Pretty much everything you name it, Joe worried about. When he worried, he would break out in a sweat and get all tense. Joe decided to join the army. He started to worry less, maybe because the army looked after most things in life for him. He made friends and his confidence listed. He still gets anxious, but not as bad. He quit at the age of 45 and decided to get a different job. And that's when all the worries came back again. What if I can't get a job? What if I'm not good at it? What if I get sick or run out of money? It got to the point where he physically felt sick most of the time. Finally, Joe's wife pushed him into getting some help. She had been seeing a mental health social worker because she was worried about the kids. His wife told him that he was making life miserable for her and her kids. This came as a big shocker for Joe, and he realized that he had been stuck in his own little world of worry. Joe went to see a doctor first who diagnosed him with GAD. Then he went off to see a psychologist. The psychologist listened carefully, asked him lots of questions, and got him to fill out a few questionnaires. The psychologist thought that the doctor was right about Joe having GAD. First, she explained how to control the physical side of his worry. Joe found that breathing exercises were the most helpful. Then she explained that the real cause of his worry was that he was always predicting the worst. The psychologist taught Joe to get out and enjoy himself now. He is exercising a couple times and visiting his old friends. He's wearing a lot less than his family has noticed. Another study in the Journal of Clinical Psychology looked at a guided mindfulness treatment for GAD. Researchers used a series of 8-week group classes with breath awareness, hatha yoga, and a body scan along with daily audio recordings. They discovered that mindfulness training was more effective than other psychological methods.